Association between sugar-sweetened beverage consumption and BMI, analysis of the behavioral risk surveillance system, and presentation of results with a proposed intervention. The specific aim for the data analysis was to assess the association of BMI and sugar-sweetened beverage consumption using the behavioral risk factor surveillance system, 2016 data for the state of New York. BRFSS data is collected via a system of ongoing telephone surveys used to collect data on health-related risk behaviors, chronic health conditions, and use of preventative services. To start the data analysis, a subset of data restricted to residents in the state of New York was created from the larger BRFSS dataset. This subsample of New York residents was used for the remainder of the data analysis. The outcome variable included in the data analysis was BMI, which was categorical with 3 categories. The exposure of interest variable was sugar-sweetened beverages consumed weekly, which was categorical with 4 categories. There were 9 covariates included in the data analysis. Sex was binary with 2 categories. Age was continuous. Ethnicity or Hispanic was binary with 2 categories. Race was categorical with 3 categories. Education was categorical with 3 categories. Income was categorical with 3 levels. Physical activity in the last 30 days was binary with 2 categories. Ever diagnosed with heart disease or cardiac event was binary with 2 categories. Ever diagnosed with diabetes was binary with 2 categories. Data cleaning was the next step. A binary indicator variable was created in order to include specific variables of interest. The main variables of interest were then examined. BMI less than 18.5 and BMI greater than 40 were excluded. The 2 sugar-sweetened beverage variables were combined into weekly sugar-sweetened beverages. The new weekly sugar-sweetened beverages variable was collapsed into 4 categories. The refused values for sex, ethnicity, race, education, and physical activity were dropped. The distribution of the values for age was assessed. Race was collapsed into 3 categories. The categories of did not graduate high school and graduate high school were collapsed. Income was collapsed into 3 categories. The 3 cardiovascular disease variables were recoded to be binary. The 3 cardiovascular disease variables were then added together to create a new variable, ever diagnosis of heart disease or cardiac event. A variable to categorize whether they'd ever been told they have diabetes was created. Lastly, any missing values were excluded to ensure all observations were complete cases. Next, regression models were run. The weighting variable was set. The crude regression with the survey weighting applied was run. Regressing BMI on sugar-sweetened beverage consumption. The adjusted regression with survey weighting applied was run, regressing BMI on sugar-sweetened beverage consumption along with all other covariates. Finally, violations of assumptions of linear regression were checked. The multiple linear regression was run. The regression model was run again using the complex survey weighting, assessing equal variance. Variables were created for residuals and predicted values. A quantile-quantile plot was used to assess normality. Looking at the exposure of interest, sugar-sweetened beverages consumed weekly. Participants categorized as obese were more likely to consume more than 7 sugar-sweetened beverages per week than were participants categorized as having normal BMI or as overweight. Looking at the covariates, there were some notable results. Black participants were more likely categorized as obese than having normal BMI or as overweight. College graduates were more likely to be categorized as having normal BMI than as overweight or obese. Participants with an income greater than or equal to $50,000 were more likely to be categorized as having normal BMI than as overweight or obese. A greater percentage of participants categorized as obese reported no physical activity in the last 30 days. A history of CVD and ever having a diabetes diagnosis. Then did participants categorize as having normal BMI or as overweight. When BMI was regressed on sugar-sweetened beverage consumption alone, the expected average BMI for someone who drinks more than 7 sugar-sweetened beverages per week is 0.43 points more than someone who drinks no sugar-sweetened beverages per week. When BMI was regressed on sugar-sweetened beverage consumption along with other potential co-founders, the expected average BMI for someone who drinks between 0 and 1 sugar-sweetened beverage per week is 0.49 points more than someone who drinks no sugar-sweetened beverages per week. The expected average BMI for someone who drinks more than 7 sugar-sweetened beverages per week is 0.47 points more than someone who drinks no sugar-sweetened beverages per week. The expected average BMI for Black participants is 0.98 points more than white participants. The expected average BMI for participants earning greater than or equal to $50,000 is 0.26 points more than participants earning less than $25,000. The expected average BMI for participants who did not participate in physical activity in the last 30 days was 0.73 points more than participants who did participate in physical activity in the last 30 days. The expected average BMI for participants who have never had a diabetes diagnosis was 2.4 points more than participants who have not ever had a diabetes diagnosis. The specific aim for the data analysis was to assess the association of BMI and sugar-sweetened beverage consumption. Data suggests that increased sugar-sweetened beverage consumption is associated with increased BMI. Data suggests that other factors such as race, physical activity, and diabetes diagnosis are associated with increased BMI. This is significant in the field of public health because obesity is a public health problem that needs attention. There's a great implication for public health efforts to address sugar-sweetened beverage consumption as a way to address the obesity crisis. Future research targeting the restriction of the public's consumption of sugar-sweetened beverages is warranted. The state of New York has received significant media attention in recent years in response to their efforts to establish restrictions on the public's ability to purchase sugar-sweetened beverages. This included attempts at a sugar tax and restrictions for people on public assistance, including the Supplemental Nutrition Assistance Program for women, infants, and children. The target population of the proposed intervention are families utilizing the Supplemental Nutrition Assistance Program for women, infants, and children. The goal of the intervention is to assess the association between the restriction of sugar-sweetened beverage sale and sugar-sweetened beverage consumption. The study is a case-control design. Researchers will collect sugar-sweetened beverage consumption data before and after implementation of a restriction on the sales of sugar-sweetened beverages to WIC families. To assess effectiveness, researchers will assess the change in sugar-sweetened beverage consumption after implementation of the restriction. Women are required to attend appointments in order to utilize the benefits of WIC, allowing researchers easy access to participants to collect sugar-sweetened beverage consumption data before, during, and after the intervention. In order to evaluate and monitor the effectiveness of the intervention, researchers will collect follow-up data at ongoing WIC appointments. This proposed intervention is prompted by the work already attempted in New York. The intervention is framed in the policy level of the social ecological model due to the need for a state-mandated restriction on the sale of sugar-sweetened beverages. The intervention is also framed in the organizational level of the social ecological model due to the involvement of the WIC program.